Hello, my name is Erica Fernandez, and today I will be presenting on protecting the adolescent's right to privacy and public health ethics. This topic is deeply personal to me as a parent, a public health student, and a health administrator, reflecting a critical challenge in healthcare today. The ethical dilemma in this case is whether adolescents should be allowed complete confidentiality in healthcare, even if it means their parents are not informed. And on one side, keeping health information private can help students feel safe enough to look for help, especially with sensitive issues. As an administrator, a parent, and a healthcare student, I have found myself caught between two deeply held values: the importance of adolescent privacy and the responsibility to protect my child's well-being. This dilemma became real for me when I pictured a scenario where my own teen might seek help for something serious, like depression, substance use, or gender identity, without me being informed or without my child letting me know what's going on. And on one hand, I understand why privacy matters. Adolescents need a safe space to talk about sensitive issues without the fear of judgment or punishment. Confidentiality builds trust. It encourages help seeking and can prevent serious outcomes like untreated illness or emotional trauma. Ethically, this aligns with the principle of autonomy, respecting the teen's right to make decisions about their own body and about their own health. But what if the decision is life-changing? What if my child were to refuse cancer treatment or begin hormone therapy without my knowledge? In those moments, my first instinct as a parent is to step in. Not to control, but to guide. Ethically, this reflects beneficence and non-maleficence, the duty to act in the best interest of the patient and prevent, of course, harm. It also touches on justice, ensuring that decisions are made with complete understanding and with complete support. And this is where my personal stance becomes very clear to me. As much as I support adolescent privacy for routine and sensitive care, but my parental involvement is ethically necessary when the decision could permanently affect my child's health or their future. Through this research, I've really come to appreciate the principle of least infringement. It's the idea that public health interventions should limit freedoms only when absolutely necessary. Confidential care should be the default, but when the stakes are high, collaboration between teens, families, and providers becomes essential. Adolescent privacy in healthcare is a complex and evolving issue that really requires thoughtful consideration. Teens often need confidential care for sensitive topics such as mental health, sexual health, and identity exploration. These issues are deeply personal and can carry stigma, making privacy essential for encouraging help-seeking behavior. Protecting their discretion encourages openness and removes any obstacles to accessing care. For example, a teen struggling with anxiety may be more willing to seek therapy if they know their sessions will remain confidential from their parents or from adults. However, when a decision is life-changing, such as refusing cancer treatment or undergoing gender-affirming surgery, parental involvement becomes ethically necessary. This reflects a balance between autonomy and beneficence, and making sure that decisions are made with complete understanding and support. It challenges us to think critically about how we define safety, trust, and responsibility in healthcare settings. We must navigate through these situations with empathy and ethical clarity. As providers and parents, it is our responsibility to make sure that these decisions are made with full information, and making sure that our teens are fully educated and that they know the consequences and they know what their future might look like, making all of these life-changing decisions and in some cases alterations. Privacy is a foundational value in principled healthcare, but it becomes controversial when applied to minors. Adolescents may avoid care or treatment if they fear their parents will be informed, especially for sensitive issues like depression or STI treatment. In these cases, confidentiality promotes safe and trust, allowing teens to access the care that they need without fear of judgment. However, when a teen faces a decision with permanent consequences, such as major surgery or even refusing treatment, parental involvement is ethically justified. This aligns with the principle of non-maleficence, which emphasizes the importance of avoiding harm. Ethical care must be protective and empowering, especially for vulnerable youth who may lack the maturity to understand the implications of their choices fully. For instance, a teen considering surgical procedures should have access to medical guidance, to counseling, to parental support, to ensure that they have informed consent, and that they are making an educated decision. Providers must assess each situation individually. Not everything is black and white, and there has to be a gray area to be able to involve parents and to apply ethical principles to guide the decisions that can change their life forever. Consider a teen diagnosed with an STI, sexual transmitted infection. Confidentiality in this case is ethically sound and legally supported in many states. It allows the teen to receive treatment without fear of stigma or parental backlash. But contrast this with a teen refusing chemotherapy for a life-threatening illness. In such cases, providers must involve parents to ensure that the teen receives appropriate care and understands the consequences of their decision. And this slide, this is where shared decision making becomes essential. This image on this slide represents the SHARE approach, a model developed by AHRQ to guide ethical collaboration in healthcare. Each step, seek, help, assess, reach, and evaluate, supports a process where teens, parents, and of course their providers work together to make informed, compassionate decisions. educated decisions. Ethical care must weigh autonomy against the potential for irreversible harm. Shared decision making, supported by procedural justice, ensures that all voices are heard and respected. It fosters trust and accountability, especially when the stakes are so high. Political, legal, and economic issues, legal frameworks surrounding adolescent healthcare may vary significantly across states and regions. In some states, minors can consent to services like mental health, counseling, STI treatment, or contraceptive care without parental involvement. In others, parental consent is required for nearly all types of care, regardless of the teen's age or maturity. This is an inconsistency, and it creates confusion for providers and honestly administrators as well, and can also discourage teens from seeking help. Law should protect adolescent privacy for routine and sensitive care, such as therapy or reproductive health services. However, when decisions involve irreversible procedures or life threatening conditions like surgery or refusal of cancer treatment, parental involvement should be mandated. This approach respects the autonomy principle, which while safeguarding health outcomes through beneficence and non-maleficence. A teen seeking birth control should be able to do so confidentially, but a teen considering gender affirming surgery should have parental support to ensure informed consent. Ethically, this reflects the principle of least infringement, limiting freedoms only when necessary to prevent serious harm and future repercussions. Policymakers must strive for legal consistency and ethical clarity when drafting adolescent health laws, prioritizing privacy and safety, but most of all, keeping our children safe. Technology and billing systems present additional challenges to adolescent privacy. Electronic health records and insurance claims can inadvertently reveal sensitive information to parents, even when care was intended to be confidential. For example, a teen's visit to a mental health provider might appear on an insurance statement sent to their home. While I do support reforms that protect sensitive data, I am also an advocate for ethical safeguards that trigger parental involvement in life-changing decisions. Utilitarianism supports privacy because it promotes better overall health outcomes by encouraging early care. However, distributive justice demands that all teens, regardless of background, receive care that is both confidential and safe. From a faith-based perspective, stewardship means guiding our youth through critical decisions with compassion and with wisdom. We must not leave them to navigate complex healthcare choices alone. A teen in a stable home considering a risky procedure should have their parents involved. In contrast, a teen in an unsafe environment may need complete confidentiality to access care. These ethical tensions must be addressed through thoughtful policy and compassionate practice. Healthcare systems must invest in privacy protecting technologies. We must train staff on confidentiality laws and develop protocols that balance autonomy with safety. Only then can we ensure that adolescent care is ethically sound and practical. Ethical theories provide a foundation for making thoughtful and responsible decisions in healthcare, especially when working with adolescents. One important principle is least infringement, which suggests that public health intervention should be as minimally invasive as possible while still achieving their goals. This means we should respect a teen's autonomy and privacy unless there is a compelling reason to intervene. Confidential care is a key part of respecting autonomy. It allows teens to seek help for sensitive issues, mental health, sexual health, substance use without fear of judgment or exposure. This builds trust between the teen and the provider, which is essential. It is very important for effective care. A teen struggling with depression may avoid care if they fear exposure, but when confidentiality is respected, they're more likely to seek help early, preventing hospitalization or school dropouts or even worse. These outcomes show how ethical care can be both protective and very empowering. However, ethical practice often calls for collaborative decision-making with family involvement. When the stakes are high, such as when a teen refuses life-saving treatment, when outcomes are irreversible, decisions must be informed and supported. Justice is another critical ethical principle. It demands that all teens, regardless of their background, have equal access to safe, respectful, and effective care. A teen from a low-income background should have the same opportunity to receive confidential counseling as a teen from a wealthier family. Justice also means protecting teens from harm, even when difficult conversations or decisions are required. Cost-benefit and analysis show that early intervention made possible by confidential care can prevent serious outcomes like hospitalization, school dropouts, or long-term disability. However, these benefits only occur when care is guided by ethical principles and tailored to the needs of each individual. Ethical theories help us balance individual rights with collective responsibility, ensuring that our healthcare system supports autonomy, safety, and justice. Privacy builds trust, and I fully support it in cases where it encourages help seeking, especially for sensitive issues. When teens feel safe, they are more likely to open up to providers, follow treatment plans, and seek care early. This trust can honestly be life-saving, particularly for youth dealing with depression, anxiety, and trauma. When decisions are irreversible or have long-term consequences, trust must also extend to families. A teen considering hormone therapy or refusing surgery should not have to make such decisions alone. In stable and supportive homes, involving parents can enhance outcomes by providing emotional support, informed guidance, and continuity of care. But at the same time, we have to recognize that not all home environments are safe. Teens in abusive or neglectful households may need complete confidentiality to access care without fear. Ethical care requires providers to assess each situation individually, balancing autonomy with protection. Matthew 18:10 reminds us to protect vulnerable youth. See that you do not despise one of these little ones. This verse calls us to act with compassion and wisdom, recognizing our sacred responsibility as caregivers, providers, and parents. Faith and ethics guide us to create systems that are just, empathetic, and responsive to the needs of adolescents. Ultimately, leading ethically involves advocating for policies that respect privacy while ensuring safety. It means training providers to navigate complex family dynamics and helping parents understand the importance of listening, learning, and supporting their children through very difficult decisions. As a future healthcare administrator, I believe that policies must strike a careful balance between respecting adolescent privacy and ensuring their safety. Routine and sensitive care, such as mental health counseling or STI treatment, should be confidential to encourage teens to seek help. However, when decisions involve irreversible procedures or life-threatening conditions, parental involvement becomes ethically necessary. This approach respects the principle of autonomy while also honoring beneficence and non-maleficence. A teen seeking therapy for anxiety should feel safe doing so privately, but a teen refusing life-saving treatment needs parental support to understand the consequences fully. Ethical frameworks must be flexible enough to adapt to the context of each case, recognizing that not all situations are equal. Training staff to recognize these distinctions is very important. Institutions they must foster in environments where ethical decision making is supported through clear guidelines, ongoing education, and open communication. This includes creating protocols for when and how to involve parents and ensuring that adolescents are part of the conversation about their own care. Applying ethical frameworks like least infringement helps guide policy decisions in adolescent healthcare. This principle suggests that we should limit freedoms only when necessary to prevent harm. Confidential care respects autonomy and justice, and it is often more cost-effective because it encourages early intervention and reduces long-term complications. However, when a teen's decision could result in permanent harm, such as refusing surgery, without a complete understanding, ethical care must include parental guidance. This ensures that decisions are made with full support and informed consent. Ethical leadership means making moral and practical decisions considering the long-term impact on the teen's health and well-being. A provider may allow a teen to access birth control confidentiality, but may require parental involvement if the teen is considering a major procedure. Policy must clearly define these distinctions and communicate effectively to staff and families. Ethical leadership involves setting these standards and modeling empathy, transparency, and accountability in every decision. When teens feel safe, they're more likely to seek care. It prevents untreated infections, unplanned pregnancies, and worsening mental health. I support privacy in these cases because it builds trust and encourages early intervention. But when a teen's choice could lead to long-term disability or death, ethical practice often calls for collaborative decision-making with family involvement when outcomes are irreversible. Public health must recognize when privacy protects and when it must be balanced with safety. The goal is to create systems that promote wellness without compromising ethical integrity. As parents, we must also strive to understand what our youth are experiencing emotionally, socially, and physically. Ethical ethical care involves empathy, communication, and a willingness to listen. Healthcare providers and administrators must work together to create environments where teens feel safe and supported while ensuring that families are engaged when necessary. This balance is by far not easy, but it is very important to promoting long-term health and resilience in adolescents. Ethical care improves outcomes. Teens who trust their providers are more likely to engage in their health journey, follow treatment plans, and return for follow ups. However, trust must also extend to families where decisions are life altering. Confidentiality must be protected, but not at the cost of irreversible harm. We must build systems that support privacy and recognize when collaboration is ethically necessary. This includes training providers to identify when parental involvement is appropriate and helping parents understand the importance of respecting their teens' autonomy. Ethics in healthcare is not just about rules, it's also about relationships, compassion, and responsibility. As parents, providers, and public health leaders, we must lead with empathy and advocate for protective and empowering care. The health and future of our youth depend on our ability to make thoughtful, ethical decisions together. This topic has taught me how ethics, policy, and personal values intersect in healthcare. It has shown me that ethical decision making is not just a theoretical exercise, but a practical, compassionate, and courageous commitment to doing what is right for our youth. I support adolescent privacy because it fosters trust and encourages teens to seek care without fear. However, when decisions are life changing, parental involvement becomes a necessary safeguard. Public health must stand as a pillar of advocacy for vulnerable populations, ensuring that care is not only accessible but also safe, equitable, and respectful. We must build systems responsive to the unique needs of adolescents, especially those navigating complex emotional, social, and medical challenges. Ethical practice means knowing when to protect privacy and when to guide decision making with empathy and wisdom. This journey has ignited a deep passion in me for healthcare leadership. I am committed to shaping policies that reflect compassion and justice and leading with integrity and vision. The future of our youth depends on the choices we make today, and I am determined to be a voice for ethical, inclusive, and transformative care. These insights will shape my approach as a future healthcare leader, and I will carry them forward with purpose and with pride. I hope to contribute to policies that reflect compassion, justice, and practicality. We must train providers, update systems, and educate families to ensure that adolescent care is respectful and protective. Adolescents deserve care that respects their dignity but also safeguards their future. The future of our youth is at stake, and the decisions we make today will shape their health, trust, and engagement with healthcare for many years to come. Ethical leadership means listening to youth voices, supporting autonomy, and involving families when the stakes are high. As healthcare administrators, providers, and parents, we must lead with integrity, support with empathy, and help with wisdom. We must recognize that adolescents are navigating some of their lives' most vulnerable and formative years. Our role is to protect them and empower them with the tools and support that they need to thrive. My goal is to help build a healthcare system that is ethical, inclusive, visionary, and responsive to the needs of our next generation. This means advocating for policies that reflect real world challenges, investing in culturally competent care, and fostering environments where teens feel safe, heard, and respected. These are the sources that supported my research and ethical analysis. I've drawn from academic texts, legal articles, and nursing ethics to try to build a comprehensive understanding of adolescent privacy. Ethical decision making is a lifelong journey, and these materials offer valuable guidance. Thank you very much, and I hope you enjoyed my presentation.